Troubling development out of Oregon. That state's health care exchange, an early and enthusiastic supporter of the Affordable Care Act, reportedly putting a gag order on its community partners to keep them from saying almost anything bad about Obamacare. Radio talk show host Lars Larson, who's based in Portland, Oregon, joins us now with more. Lars, you did your own investigation into this, and you unearthed something that made you think that there's a gag order?
Allison, here's what I did. I got suspicious last week as to why none of the major health institutions were saying anything bad about Cover Oregon. That's the name for the local version of Obamacare. So I filed a public records request for a document that I'd been told by somebody within the healthcare institutions was keeping them from talking about it. This is somebody in the upper echelons of one of the major healthcare institutions who said, we can't talk about it. They have a non-disparagement agreement they've made us sign. So I filed a public records request. They denied the existence of the document. So I talked about it on my talk show, and sure enough, somebody who had a copy of the document sent it to me and said, this is the document they're denying. We then filed another request and said, we want this document. We asked for it by name. They then admitted that it existed. And here's what the document says. If you're a community partner of Cover Oregon, you are not allowed to say anything bad about Cover Oregon, and it is a one-directional agreement. That is, if the state or Cover Oregon decides that you've voided the agreement and said anything bad about them, the threat in the document is we will cut you off from money from Cover Oregon. Now, Oregon is arguably one of the worst examples in the country. We all know it's a meltdown nationwide in Obamacare, but Oregon got in early. It spent $300 million on one state website that was supposed to launch 2.5 months ago, and as of today, they still don't know when the site will work at all.
Okay.
They have signed up a total of 44 people. It's a meltdown.
Okay, so now correct me if I'm wrong, but it sounds
Sure.
like the non-disclosure agreement that you found says that you're prohibited from saying anything, quote, false, misleading, deceptive, libelous, defamatory, or obscene. So basically what it sounds like they're trying to do is protect against misinformation.
Well, but that depends on how you define misinformation. You understand that if you listen to the Obama administration, Obamacare is working great. And if you listen to the folks from Cover Oregon, they say, oh, this is fine. We've just switched to paper applications. But the way it's being read by the healthcare institutions, remember the original tip that led me to this when I got suspicious was we're not allowed to criticize Cover Oregon. If we criticize them, they will cut us off. That's the way that one word, defamatory, is being read. Misleading. Well, if the health institutions say, listen, this thing isn't working and people are going to be hurt by it, Cover Oregon could say, you just said something deceptive, we're cutting you off. They've effectively taken the taxpayers' money and used it to point a gun at the head of these institutions and say, if you say anything bad about us, we're going to cut you off from millions, maybe tens of millions of dollars. And none of those institutions want to do that.
And Lars,
this is a fraud.
But who has to sign these things? Are these community outreach groups that are going around trying to sign more people up? Who exactly is being asked to sign the non-disclosure?
The community partners are outreach groups, but most of them are affiliated back to a healthcare institution. And the way the institutions are reading it, if you read into the document, it says if any of your officers, directors, boards, or affiliates of your outreach organization say anything, breach this agreement, then you're in trouble. That means that a major healthcare institution, and many of these are amalgams of, both hospitals and clinics, doctors and nurses, as well as coverage plans. If anybody in any of your affiliates breaches this agreement, we cut you off. Now, the new director, the acting director, who was just appointed a short time ago, Bruce Goldberg, who's a medical doctor, he said that he, A, didn't know that the agreement had been created, B, thought it was a terrible idea, and C, said he would now try to get rid of it, but only because we brought it to light.
Lars Larson, thanks so much for sharing your investigation with us and all that information.
Merry Christmas, Alice.
You too.
And to you.